Good day everyone, I'm Junce Metante from BSN1A17. So for today, I'm going to perform a return demonstration on the assessment of the thorax and the lungs. So prior to performing the procedure, I'm going to of course perform proper hand hygiene to deter the spread of microorganisms and to prevent cross-contamination. After that, we can now proceed with the assessment. Good day, I am Junce and I will be your student nurse for today. So can you please state your name for me, please?
I'm Metante.
And your date of birth?
I was born on May 4, 2004.
Okay, so that would be the first step. You have to verify the patient's identity to ensure that you have the correct patient in front of you. And if there are any doors and curtains, you have to close it to provide patient privacy. After that, you can now proceed in explaining the procedure and its purposes to the patient. Okay, so how do you want me to call you?
Just call me Jan.
Okay, John. So for today, I'm going to check your thorax and lungs. I'm going to examine it anteriorly and posteriorly. I'm going to do inspection, palpation, percussion, and auscultation. This is for me to ensure that everything is normal, and if there are abnormalities, I'm going to take note of it to prevent any further complications. So do you have any questions before we begin?
No.
Okay, but if you do have, you can just ask me throughout the assessment, okay?
Okay.
Okay. So John, can you please take off your shirt?
Okay.
Going to place the gown. Okay, since I'm going to start in examining the posterior aspect of the chest, hence I'm going to ask my patient to turn around. So, John, can you please turn around? Okay, good. So now, first things first, I'm going to do inspection. So what are we trying to inspect here? And we are trying to examine for the skin, the bones, and the muscle of the spine, the shoulder blades, and the back, as well as the symmetry of expansion and the accessory muscle used during respiration. Okay? So as I am assessing the posterior thorax, it is symmetrical with symmetrical chest expansion, and there is no thorax deformities like what you can see in barrel chest, funnel chest, and pigeon's chest. Okay, there is no skin discoloration. Okay, there's a massive swelling. John, can you please stand up? Okay, so what are we trying to examine here? I'm trying to inspect the spine alignment for any deformities. Okay, so I'm going to observe on three normal curvatures, which is the cervical, the thorax, and the lumbar. Okay, so as I am inspecting, the spine is vertically aligned. There is no exaggerated spinal curvature like what you can see in the kyphosis, which is exaggerated curvature in the thoracic, and also for the lordosis, which is exaggerated curvature in the lumbar. Okay, and also I'm going to inspect for any signs of scoliosis or the lateral deviation of the spine. Okay, so as I am inspecting, the spinal column is straight. The left and right shoulders and the hips are at the same height, which is normal. Okay, John, can you please sit down? Also, we have to observe for the breathing patterns. Okay, so as I'm assessing it, it is quiet and labored respiration. with no use of accessory muscle, and the rhythm is regular, okay, which is normal. That is good. We're also going to assess the anterior, posterior, and lateral diameter of the thorax. So as I am inspecting the anterior, posterior, and transverse diameter is at the ratio of 1:2, which is normal. After inspection, we have to do palpation. So first things first, I'm going to palpate for temperature, tenderness, muscle development, and masses. Okay. So as I am palpating, the temperature is normal. Okay. John, do you feel any tenderness or pain? Okay, good. No tenderness felt. Okay, and I don't feel any masses, which is normal. After that, I'm going to palpate for the tactile fremitus using the ulnar aspect of my hand. I'm going to do it from side to side. I'm going to compare and do it from side to side. Okay. Can you please say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so as I am palpating it, it it has bilateral symmetry of vocal fremitus, which is normal. There is no decreased or absent fremitus, which is associated with pneumothorax, or increased fremitus, which is commonly present in patients with pneumonia. And also, I'm going to assess for thoracic expansion. By doing that, I'm going to place both of my hands around the 10th rib. Okay. So with the thumb close to the spine, I'm going to push it medially. Okay. To get a little bit of the skin in there, and where we can watch it to expand. Okay, so John, can you please take a deep breath? Okay. So as I am assessing it, it has full and symmetric thorax expansion, wherein when I ask my patient to take a deep breath, my thumb move upward on equal distance and at the same time, and also normally um, the thumb moves 3 to 5 centimeters. Okay, so everything is normal. So after palpation, we can do percussion. So I'm going to percuss over the posterior and lateral lung field for tone. Using the zigzag pattern, I'm going to start above the scapula to the bases of the lungs. I'm going to take note for the intensity, pitch, duration, and the quality of sound produced. Okay, so I'm going to, in doing this, I'm going to ask my patient to bend his head and fold his arms forward across his chest. This is to separate the scapula and to expose more lung tissue to percussion. Okay, so John, can you please bend your head and put your arms like this? Okay. So it should be nice resonant sound because the lungs is filled with air. But if you palpate or percuss over the ribs, you will get a dullness. Okay, so after percussion, we can now move on to the auscultation. So I'm going to take my stethoscope. I'm going to use the diaphragm of my stethoscope in listening to the breath sounds. Okay, John, so whenever you feel my stethoscope touching your back, um, can you please take a deep breath slowly, okay?
Mm.
Okay, good. So as I am listening to the sounds, I hear, I hear vesicular and bronchovesicular breath sounds, which is normal. There is no adventitious breath sounds like crackles or wheeze, which indicates abnormalities. So that is the end in examining the posterior aspect of the chest. We're gonna move on to the examining the interior aspect of the chest. Okay, so John, can you please turn face front? Okay. So first things first, I'm going to do inspection. I'm going to examine the skin, the bones, and the muscle, as well as the symmetry of the lungs expansion and accessory muscle cues. Okay, so as I am examining, there is no skin discoloration. The anterior thorax is symmetrical. There is no thorax deformities, and the costal angle is 90 degrees, which is normal. Okay, so after inspection, I'm going to do palpations. So I'm going to palpate for any subcutaneous air trapping. Okay, and then also I'm going to palpate for the respiratory excursion. So I'm going to place the palms of my both hands to the lower thorax and have my patient take a deep breath, okay, as I observe the movement of my hands. John, can you please take a deep breath? Okay, so as I observe, it is full symmetric excursion, and my thumb normally separates 3 to 5 centimeters. Okay, so now I'm going to palpate also for the tactile firmities. Okay, the same with the with what I did in the posterior aspect of the chest. Okay, so again, I'm going to use the ulnar aspect of my hand in palpating for the tactile firmities. Okay, so John, can you please say 99?
99.
Okay, so tactile firmities, it is the vibration in his words coming through. Okay, so you can normally feel those, and this should be symmetrical from side to side. And as I am assessing it, it is symmetrical, same in the posterior vogal firmities, and the firmities normally decreases in the heart and the breast tissue. So now I'm going to do percussion. So in percussing, I'm going to do it systematically. I'm going to begin above the clavicles and proceed downward to the diaphragm. Okay, so I'm going to place my finger on various spots and I'm going to tap my finger. What I'll be hearing is a certain sound called resonance when I get over with the lung tissue. But when I get over the heart, I'm going to hear the sound called dullness. Okay, so after percussion, we can now move on to auscultation. And by doing that, I'm going to use my stethoscope, specifically the diaphragm of my stethoscope, in listening to the breath sound. So I'm going to auscultate the lungs through the anterior thorax as the patient breathes slowly and deeply through the mouth. Okay, John, whenever you feel my stethoscope touching your skin, can you please take a slowly and deep breath through your mouth?
Okay.
So as I am listening, I heard the bronchovesicular and brasicular breath sounds, which is normal. Now that we're done in the assessment of the thorax and the lungs, we are now going to proceed in the assessment of the breast and the axilla. First things first, I'm going to do inspection. Okay? So as I am inspecting, the breast is even with the chest wall. Okay? And the skin is uniform in color and it is smooth and intact. Okay, so to emphasize any retraction, I'm going to have my patient place his hand on his hips and raise the arms above the head. Okay, John, can you please place your hands on your hips? Okay. Then, can you please raise your arms above the head? Okay, good. So, as I observed, there is no retraction present, which is normal. Okay? You now, okay. So, after inspection, I'm now going to do palpation. So, I'm going to palpate first the axilla. Do you feel any pain?
No.
Okay. So, there is no tenderness, no masses also, or nodules, which is normal. So now, I'm now going to palpate the breast of my patient, and in doing that, I'm going to assist him in a supine position. Can you please lay in the bed? Okay. So in palpating the breast, I'm going to follow the vertical strips pattern. Okay? So do you feel any pain?
No.
Okay, on the other side. Do you feel any pain? Okay, good. There is no tenderness and I don't feel any masses or nodules in the breast. So now I'm going to palpate the nipples of my patient. Okay? Do you feel any pain?
No.
Okay. I don't see any discharges also in the nipples, and I don't feel any masses, which is normal. So after performing all the procedures, you can now assist the patient in replacing the gap. Okay. So John, can you? Okay, so after that, I'm going to perform hand hygiene and document the findings. And if there are any abnormalities, I'm going to refer it to other healthcare provider for further evaluation. So that would be all. Thank you.